Thank you, Dr. Kuheli. First one. Yeah. Yeah. So I think with times we change, our purviews change. Every decade of life, things change and teach us new avenues, new ways to grow in personal as well as in your professional lives. And this is a kind of, a generation gap, which is seen, it's called silent generation, baby boomers, generation X and millennials. And you can just figure out by when you were born and which generation you belong to. But the matter of the fact is we are all, whichever generation we belong to, we are all practicing in the same group of patients. And so we have to grow with the growing generations too. So what do you do in your practice usually to market your practice? You believe a lot in word of mouth. It takes time and it's a long drawn process to let word of mouth grow your practice. The traditional free eye camps, as we know, outreach services are very difficult in private practices, and the in-reach of patients converting into surgeries are also lesser. And then how do you connect to each other is through conferences like this. So this is all India conferences, and now we know more and more conferences are coming up to connect all of us more. But are we really going to be able to save ourselves from social media? No. This is a study done in rural India, mind you, and it shows there are 120 million rural Indians who are connected on the internet. With Geo and all these kind of price slashes, it's going to be 315 million by next year, 2020. So you want to connect to rural India, you have to get online. Reasons why doctors use, most of us, I think, use it still for personal usage. And I think it's a great time drain because you're looking at other pictures, other people's pictures, getting jealous, going down and feeling emotionally low. But you can connect and make yourself use this social media for professional usage. There are so many articles and more. There is a difference between European style of working and American style of working. Like a lot of you would know, Europe is still having a patient-doctor gap, and they don't want to interact much with the patient. They are still not accessing themselves to this online exposure to the patients, and they try to maintain a distance vis-a-vis the completely friendly American style. Now, as we know, these two are actually quite sizes. Medicine is all about privacy, confidentiality, one-on-one interaction, and a formal conduct. Opposite is social media, where you have sharing and openness, connection, transparency, and informality. And how do we blend this? This is a dream. This is a doctor who is an intensivist on Instagram. And look at his followers, 2.8 million followers. This guy has more followers than Meghan Markle or, for that matter, most of the Hollywood stars too. But this is the reality. Do you want your vacation pictures to go online or your children's privacy being compromised? No. So what are the do's and don'ts? What can you use your social media in your practice for? Patient visibility, sharing general health information, share and read research articles, increase your credibility in the ophthal world, share and learn from video formats, share research articles, networks, and mentor or mentee from a mentor, and get job matches. And I'll be elaborating how to do that. But before that, I want to warn you, there are dangers here. There are dangers. Are we all ready for this world? So this is what we want to become. We want to become this. But this is what we can do. So these are two interns who were sacked from their internship because they posed with an amputated foot smiling, and another doctor who was smiling with an harlequin baby who died within 1 hour of delivery. So don't make yourself lose the empathy when you kind of go online. And so there are so many guidelines. My friend Dr. Anupma will be going through the guidelines, but there are lots of guidelines in the European and American societies. to lay down rules as to how to use social media for doctors. India obviously is still coming out, and we haven't had any formal guidelines coming from our boards, but very soon I think there will be formal guidelines in place. But don't be afraid and save yourself, because as I mentioned, these are the number of users who are using Facebook, Twitter, and LinkedIn in India. And 7 out of 10 customers expect a business to have a well-maintained social media presence. 17% of your customers use social media, and the figures can be even more. And it's increasing. You see your liftmans, your maids, your cooks all carrying these nice smartphones. So they're all on the social media, and that is your patient base. Sadly, ophthalmology again has 2 kind of patient bases. One are these free camps or free things that we are expected to do from the government, CGHS, EHS, Arogya, Shri Arogya Bhadrata, we have so many. And the other are these. Practo, Lenskart, Call Health, all these are kind of startup companies who have entered into the market, and they are taking your business away. You have Practo associating with doctors, eating up the practice, and kind of making it very, very, very difficult for a standalone practitioner to stand strong. So, and you have these jazzy advertisements, which get played in theaters and in railway stations and in metro services. So how do we stand alone and kind of increase your practice? Mind you, your word of mouth has changed. Word of mouth has become online. They go into all kinds of sites and write negative reviews, which can be quite visible for your practice. The only way that you can get your practice to get a positive name is to increase your positive reviews so that the negative reviews are not seen much. So you need to get online. And there is extremely price-sensitive customers. So they don't care whether you are Mr. Z or Dr. X or Dr. X's child. They are worried about the price. So they have 10 other hospitals, and they're just going to bargain about the price. But unless you increase your credibility to that level in the actual world, of course, and also on social media, you might be selected out of those 10. So learn the smart way. First of all, make a website. I think website making, we've seen so many patients checking you online, looking at your website, and then that's the first thing that they click. So you can write about your team, you can make a hospital tour, you can write educative blogs, which again increase the traffic to your website. You can get in your patient testimonials, your awards, your recognitions, your conference attendings, your published papers, everything on your website, and see that you bind with a company which kind of does this SEO. So your websites have to be kind of optimized so that they can be accessible for the public. So make an SEO optimization of the website. So the next platform, like Dr. Rachna said, Facebook, yes. Facebook and Instagram are your Web 2.0. So the first version, website is something which is going to stand alone there, but it's not going to be interactive. This is going to be more interactive platform rather than passive viewing. It's going to have fresh content. You can advocate for something. You can put public health initiatives. You can let your patients put videos online, or Facebook Lives you can do. So Facebook Live is a feature where you can go online, have a short video, which can again increase your views. You can do Instagram stories. You can share blogs and YouTube videos on your platforms. So these are kind of examples where you can do anything which you want, like something against means if you want to promote a contact lens, or if you want to promote a new LASIK procedure or a new phaco machine, you need to kind of get online and write short videos, make a short video, make a short blog about it, and then share it on your platforms. Like this is an example of Facebook Live, where you have a lot of dermatologists putting Botox videos online. And of course, it requires consent from the patients, which will be talked about again in the legal aspect of social media. But then these again drive a lot of patients into viewing it. Or you can also kind of guide your patients to support group. Incidentally, all 4 of us are pediatric ophthalmologists here. So you'll see a lot of kind of pediatric examples that we put up, and it's here, like you have nystagmus network for patients with nystagmus, or retinitis pigmentosa support groups. So you can even kind of put your patients, you have a standalone child with a nystagmus, and the parents are actually quite distraught with the news, and they feel they're the only one who is affected with this. But if you connect them to these kind of support groups, it's very useful for them to get more information, to connect with more parents, how to teach your child through school, how to give vocational training. So there's so much of interactive discussion between them that you create a small kind of family for them with children who are suffering, or with patients suffering with the same kind of disease. So this is what many a times I do, and most of them have Facebook accounts, so they can go online and kind of join the support groups. Or you can be a part of these kind of great initiatives. So this was an initiative by Facebook in India, and they kind of wanted to promote blood donation in India. And so they just made this kind of thing where you can actually vote whether you want to become a blood donor, and if you say yes, then you would have local groups or local blood banks contacting your number and asking when you can come for a donation. Maybe this can be true sometime for corneal donations, where you can actually register online through Facebook. The reach is far and wide. But yes, learn to keep your privacy intact. One very important thing that you can do is, when you have a hospital or when you have your practice on Facebook, then have a kind of an alias for your own personal family and friends name. So suppose you have say Dr. Aloka for the professional, then you can make it like AD for your personal friends, so that the patient cannot find your personal information, and then learn how to keep your privacy intact. So Facebook, Google+, all of these have where you can select that all those pictures that you go to can be viewed only by your friends or acquaintances. So this you can do. Google Plus also has a kind of separate thing where you can have friends in one, family in one, you can have your work acquaintances in another, patients in another. So these circles will help you protect your personal data for only those you want to share with. I also give a lot of guidelines to my patients' parents to go online and register for. This is a kind of an example where there is a website which is made by parents of a child who goes through cortical visual impairment, and they have even made an iPad stimulatory iPad videos or iPad games for children to do vision stimulation exercises online. So the littlebearsees.com, and they give a lot of material free of cost to parents of children suffering from these. So only if you go online and learn about these things, you can guide your patients better. Or this Instagram group for patching children, where they teach all different ways where you can encourage patches, and you can even draw on the patches. They have competitions, they have patching support groups. So you can guide your patients to go and kind of be a part of these support groups. This is another great thing called naidisha.org, which works with children who are special children. So either cerebral palsy or different kind of special these, like you see on your left, these are there in all the cities, almost all cities of India, and they are the ones which connect the patients with care providers like ophthalmologists, physiotherapists, dentists. So if you register yourself for that group, then the parents can select your practice and come to you for direct consultations. So get online and go and join these initiatives. This is a started company which started 5 years back by Indians who were residing in America and saw how good network was created. So they are trying to create it in India too. So if you are a part of these kind of online services, your accessibility for the patient increases. Of course, YouTube videos are amazing, where the number of views will kind of drive traffic towards your practice. You can even give guidance about going to certain, now we know that the content for certain videos is much better. Suppose you want phacosurgery or a patient to see a phacosurgery, you can tell them that this is kind of the website that you go to, this is the video that you can see. Incidentally, when I typed phaco, you see this is Dr. Ramakrishna from Hyderabad, where he has 13,000, more than 14,000 views, and that's a huge number. So that can be patients, that can be doctors, and when they access, and when there are a lot of patients who go back home and see what you have. So if you have said MICS, they're going to go online and see that video, and if your video comes out first, then it's definitely going to be selected for surgery. So these are certain live videos, or you can connect with a kind of local TV news group, and they kind of put it online on their YouTube website, and therefore indirectly the number of views can be increased. International society support of like for all of us, glaucoma society, European American societies, the APOs, they have amazing website content, lots of free downloadable books, lots of free videos which you can access for growing your knowledge sitting right in your bed. There are a lot of online courses, like this course on phacosurgery, which is a 6-week course where they go from preoperative workup to the kind of, obviously it's not on, you can operate, but then you can see lots of video access, and you can go through a lot of theoretical content which can make you certified for phacosurgery. Like exams and fellowships, of course, we know MRC Ophthal and ICO fellowships are all accessible only online, and the more you network with people, you get more and more opportunities and more online guidance as to how to crack these exams and how to get a great fellowship. Twitter, it has like more than 2 lakh followers now for this at the rate NEJM. So this is New England Journal of Medicine, which got onto Twitter, and then they created more than 2 lakh followers. AIO, of course, has, again, a great Twitter content, and 23,000, more than 24,000 followers. And they put up a lot of live videos, they put a lot of free journal access, free papers onto the Twitter account. And of course, what do you do in a conference? How do you win a conference? There are a lot of ways where you can go on Twitter and online kind of write hashtag about the conference, or meet people, or create a group. Like suppose 5 of us want to do a phaco fellowship somewhere, and you can actually access it through Twitter. You can write it down, and then you can kind of interact and go together and do that fellowship. So the opportunities are amazing, and they're endless. You just have to kind of make yourself open up and access this. Of course, what you tweet about, so you can tweet important information, you can share cabs, you can tweet your talk, you can tweet about industry bargaining like it happened just before this, or you can tweet your pictures and videos from the conference. So this is your AIOS office, and you know about this talk, you can tweet by hashtag #socialophthal. So these are all, so you can share your studies, and like you can even help. This is a Dr. Rahul Jha who helped a lot during Chennai floods. He went online, he tweeted that I can give medicines, I can do deliveries, and there were so many people who saw the tweets and who could access medical care online. So the healthcare initiatives can also be done amazingly there. Or you can even do these kind of, you can create your hashtag. This is an example of how health industry can start workouts and become fitter and better and stronger for your own self and for your patients. So you can join such kind of initiatives. A warning, of course, is no political or racist tweets, because you can really lose everything that you gained. Like this doctor who sent a lot of anti-Semitic tweets and was fired and lost his medical license also in the US. Journals, of course, we know IGO is on Twitter, and you can access a lot of material, and now there is a new metric system which will review the impact of your peer reviewed journal on the society. So if by tweets the number of people who are viewing your journal content or your own research content is more, then your metric system goes high for that journal too. Of course, look what I found online. Our Dr. Pradeep Sharma's Strabismus Simplified, right accessible at your Kindle, so you can kind of download at very low cost and read online. And also you can share presentations on slides like this with slideshare.net, and you can put it on the LinkedIn account, which is a kind of a good networking, and people know that your content is accessible, and it will help a lot of students. So network among ophthalmologists. It helps you by docplexes or LinkedIn, and it can get you job opportunities that you didn't know of, and it can also kind of join the mentor and mentee, like this thing by WOS, Women Ophthalmologists Society, where it's a kind of online accessibility between a mentor and a mentee, things which in your own private practice in a smaller place is not accessible to many of us. Get your iPads to hospital. You can show videos to your patients, and very importantly, please take Google reviews. Now, this is our own hospital, which is a 3-year hospital. We have 5 branches now, and we have a kind of 5-star rating on Twitter, and you won't believe it, just yesterday we had a patient, a young UK couple with one eye, operated in Moorfields Hospital for retinal detachment, landed in India, have come for holiday, got the other eye retinal detachment, just saw Google review, high rating, came to the hospital, and they got operated yesterday. So you get selected because of your online rating. Believe it or not, accept it or not, that is the reality, and you must get online, and you have to respond to your patients. So on Google reviews, you can reply back to your patients, and that creates a good relationship. Or this amazing thing done by Dr. Natarajan. He got WhatsApp message about the pellet injury that all of us got in 2016. He created a group, and 3 of them went to Kashmir, operated the patients, and they did some 30-40 retinal surgeries in the entire day. So use your social media more logically, and use it for your patients. So the first slide, so you can increase your patient visibility by Facebook, website, Twitter, Insta, Google+. Share general information by writing blogs on your website or on your Twitter account. Share and read your research articles. Increase your credibility by Facebook pages and YouTube videos. Share, learn video formats. So learn how to make good videos, learn how to document your cases while doing surgeries, be comfortable in front of the camera, which is a tough job for all of us who've been shelled inside for the last 20 years. Share your research article on ResearchGate or DocsPlexus or Twitter. Network and mentor or mentee on online platforms, and get job matches on LinkedIn. Mayo Clinic has started a completely different wing called Mayo Clinic Social Media Network, where they are on all the platforms of social media, and they connect a lot with their patients as well as the societies, the ophthalmology societies. Very big warning, which again my friend will talk about, is maintain the privacy of your patients. Don't just tweet or share anything and everything. And a big warning, once you go online, you will get negative reviews. So don't let the vitriol affect you personally. Get the positive reviews to cushion from you from all 360 degrees, and just ignore the negativities. Another main thing is addiction. All of us would get addicted to looking, checking, posting, and try to kind of cut down and give only that 10-15 minutes or half an hour time to the social media.
Dr.
And
Aloka,
take assistance to manage your job. You can hire a lot of good guys in the market. So yeah, thank you. Be online and see you offline too. Thank you.